Okay, what's your name?
My name is Kim.
Kim, nice to meet you. And tell us about your hair loss. When did you first start noticing your hair loss?
It was about 10 years ago.
Okay.
I went to a hairdresser and I had weave put in, and
Okay.
she glued it in.
Huh.
When I went back to have it removed, she pulled it out.
So it was
And-
glued in, or was it?
Yes,
Okay.
it was glued in, and she didn't use proper precautions to remove it. And
Yes.
it ended up pulling out most of my hair.
Okay, and that was 10 years ago.
Yeah.
And did it thin out since then, or was it okay? So it never really grew back the same way. Okay. Now, is this run in your family? Has anybody else had this in your
No.
family, or you're the only? Okay.
I'm the only one.
All right. And so it's been like this for 10 years.
Yeah.
How does that affect you? I mean, as a woman.
It's messed with my self-esteem at
Sure.
times. I don't wear my hair out, and
Okay.
when I do, I'm constantly trying to cover up my edges. I
Yeah.
wear a lot of wigs. I wear a lot of weave, which does not help it.
Right.
But it's what I've been doing, and I'm tired
Sure.
of doing it. I just want to be normal in my state of mind,
Right.
and I just want to get this fixed.
Mm-hmm.
And once I get this corrected, I will not be doing it.
And it's important to know that you shouldn't be doing any glue-in wigs or
Yes.
anything like that. So
Please
if you are,
don't do that.
trust me, yes. And so the way that you wear a wig now should be just kind of a one that sits on the head or clips into the side. Nothing that's
Yes.
going to put any-
Ladies, if you're gonna wear a wig, put a scarf on first.
Yes.
Tie that scarf around your head. Then put a stocking cap on top of that,
Yeah.
and then put the wig on. That's the only way you're gonna protect your edges. If you don't, and you put that wig on with just a stocking cap, that stocking cap is gonna rip your edges out.
And we'll see you here.
Trust me, I know.
Take it from her.
Yeah.
So tell us about your research. I mean, so okay, you had the problem. How did you
Yeah.
how are you even aware that this was an option, or how did you?
I have been researching this for about maybe a year or two.
Okay.
And off and on I let it go, thinking
Okay.
that my hair would grow. I was
Sure.
using different kind of oils, and
Right.
nothing seemed to be working.
Okay.
So finally I just got tired of dealing with the oils and all of these products, putting
Yeah.
these products on my hair.
Yeah.
And I was talking to one of my best friends about it, and she said she was thinking about getting a procedure.
Uh-huh.
So I said, okay. So I started researching it, and I found two doctors. Dr. Huebner was one of the physicians that I found.
Uh-huh.
The other doctor, I was kind of iffy.
Okay.
So I went into YouTube, and Dr.
Yeah.
Huebner had a lot of videos that was posted
Right.
doing African American procedures.
Right.
One lady in specific from Tampa that he did was Tanya.
Yeah.
Tanya had the exact same problem that I had.
Mm-hmm.
Mine was probably a little bit more extensive than hers, but we were basically along the same lines.
Yeah.
So I even went into Pinterest. He has videos on Pinterest
Uh-huh.
that he did males,
Yeah.
Caucasian males, even black females on that site.
Yeah.
And I called and spoke to Jerry about it, and
Yeah.
Jerry gave me some good information, so here
Good.
I am.
Awesome. Well, we're going to make this go away today. I'm very
Yes.
excited. You're going to be the next Tanya. So thanks again for sharing your story with everyone. And we're going to be checking in throughout the day to see how you're doing, how everything's going. But thanks again. I guarantee you this is going to help women in their research, because there's not a lot of resources out there for especially for traction alopecia. So thanks again, and we'll see you soon.
Okay.
Okay, I'm here with Kim, and at this point in the procedure, Kim has had her strip taken out. She's all sewn up, and she's had all the sites made on the top. But I wanted to get from Kim's mouth how things are going.
Hi, family. I'm doing good. It wasn't as bad as I thought it would be.
Yeah.
It is an experience, so I think it's worth it.
Okay.
In the end, I think it's going to be worth it.
Yeah.
Dr. Huebner is awesome. His team is awesome. They had me laughing all morning.
You had us laughing with your.
I think it's going to be great. I can't wait. I
Good.
can't wait.
But right now you're comfortable. We're listening to some
Yeah.
Beyonce and just
Yeah,
chilling.
they got me comfortable. They feeding me, making me fatter. So,
We're about to
I'm
order
good.
lunch. Yeah, awesome.
Yeah.
So I'm going to kind of pan around here and show everyone. So these are all little tiny sites, and it's normal to have a little post-op oozing, not much. But you can see where a new hairline's going to be. You can see all the sites. Now we come down on the side, put our edges back. So the next step, the only step left actually, is to to place all those grafts in those slits. So anyway, thanks again, and we'll be following up with you. Thanks.
Okay.
Okay. Okay, I'm here with Kim, and we've just completed her surgery. Kim, overall, how was the day for you?
Family, this is the real deal. It wasn't bad at all. Once I got my medication, I was fine. You know, I fell asleep a couple of times.
Yeah.
So it wasn't bad. Ladies, if you're having this problem, please get this done. Don't go through life with this. They have payment options you can work with.
Yeah.
Dr. Huebner is awesome. His team is awesome. Get this done. I know I look like Frankenstein now, but in about 4 or 5 months, I'm going to be back to diva. Trust me.
That's right.
So get this done.
You're a diva at heart. Now we're just going to make the looks go with it. So I can see, I'm going to kind of zoom in here. You can see where her new edges are going to be, and you can see how that's going to reframe her face.
And I would definitely keep you guys posted.
Yes, I appreciate that. So do the women looking to do this, because they see you now, but what are you going to look like in 4 months? What are you going to look like in 6 months, a year? That's super important.
I will definitely keep you posted.
Yeah. Now remember, nothing's going to grow for about 3 to 4 months, and then your final results at a year. So it's a little bit of a process getting it back. But in the meantime, you're already wearing bandanas and scarves, so it's not a stretch to wear those for a couple more months. So thanks again, Kim, and we really look forward to seeing your results. Thanks again.
Sure, Dr. Huebner, anytime.
Okay. Yeah. Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.